family, welcome to my YouTube channel once again. My name is Michael, you can call me Mike. Please, if you are new here, kindly subscribe to the YouTube channel, and if you are old here too, please get yourself a desk and let us get started. Today we are going to talk about the conduction system of the heart. When we talk of the conduction system of the heart, the conduction system of the heart is a specialized network that is being established by the cardiac muscles to generate electrical impulse and then transmit this electrical impulse throughout the heart, so that every part of the heart will get excited and then the heart can also undergo contraction. So this is basically what we call the conduction system of the heart. Now, if you take the heart, the cardiac muscles, let me use black so you can see one. So the cardiac muscle has two main cells, which is the nodal cells and then the contractile cells. The contractile cells, they are cells that undergo contraction, as the name implies, contractile cell. And because of that, they have this contractile protein, the actin, the myosin, the troponin on their surface. But this nodal cell, they do not have these contractile proteins. So because of that, they do not contract. What they do is they generate the electrical impulse to be transmitted throughout the heart, so that the contractile muscles can also get electrical impulse, which is the action potential, and then undergo the contraction when they get themselves excited. Now, from the nodal cells, these nodal cells, as I say, they undergo the generation of action potential, and these nodal cells help the heart to be independent. That means they themselves can undergo the generation of action potential without the intervention of the autonomic nervous system in this process. Now, this is called the automaticity of the heart, the ability of the heart to generate its own action potential or its own electrical impulse to be transmitted without the intervention of the nervous system. Now, on top of that, these cells start at the SA node. First one that we are going to talk about is the SA node. The SA node. The SA node is the first node that we are going to talk about, and it's called the natural pacemaker. So this is the SA node. It's a natural pacemaker. Why are they saying it's a natural pacemaker? The SA node on its own generates electrical impulse 60 to 80 times per minute. So this SA node, its electrical impulse that it generates, potential reaction that it generates, determine the rhythmicity of the heart. So the heart rate, at a rate in which the heart contracts or the heart beats, is being determined by the SA node, which is what 60 to 80 times of a normal heart without intervention of the central nervous system, or the autonomic nervous system. This is how the heart must contract, or the heart must beat from 60 to 80 when the heart is normal. And this is being determined by the SA node. Now, that's why we say it is what the natural pacemaker. Now, from the SA node, when you generate the action potential from the SA node will transmit it through this pathway into the left and then the right atrium. All the muscles, they must get themselves excited so that they can undergo the contraction. Now, through the, let me say 2, this is, let me put 2 here. This is what we call the anterior interatrial bundle, or the Bachmann bundle. 2. This is the pathway leading to the left atrium, so that all the muscles or all the cells in the right atrium can get themselves excited together with the right atrium so that the two can go contraction together. Now, after that, the electrical impulse is being transmitted through this pathway, which is called the internodal pathway. They are called internodal pathway. The internodal pathway, we have the anterior, we have the middle, and we have the posterior. They all bring the electrical impulse into the AV node. So this is my AV node, which is located at the superior part of the tricuspid valve, or at the posterior part of the tricuspid valve. If you take the tricuspid valve, this is the anterior, this is the posterior. And then this SA node is located at the superior posterior lateral of the right atrium. That is, when you take the vena cava superior, the superior vena cava, what you see, it is beneath the superior vena cava. And this is where we can find the SA node. Now, after that, we transmit the electrical impulse through the internodal pathway, and the basal band also bring its own and then get to the SA node. When the SA node gets the electrical impulse, it delay in the transmission because the SA node is being structured in such a way that one, it has low level or decrease in number of gap junction. When you talk of gap junction, what is it? Now, if we take cells, let me take these three cells. These three cells, they are connected together. One to another by what we call the intercalated disc. This intercalated disc connects one cardiac cell to another. And in the intercalated disc, we have these channels over there. That permit the movement of excitatory ions from one cell to another. So if this cell is the one that has been excited, its excitatory ion, that's the positive ions, will move from here to this place and get this cell excited. And because of that, all the cells in there can get excited and then undergo the contraction at the same time. Now, if you take the AV node, these gap junctions, they are small, or they are decreased in number. Their number are very small, and because of that, the excitatory ions moving from the SA node into the AV node delayed, and will take time before they can all get to the AV node. And because of that, it causes the delay of about 0.13, total delay of 0.13 seconds before it can take it. And because of, it's not that one only, and two, it has a decrease in number of, or decrease in size of the AV band fibers. The AV fibers. So these AV fibers, they are also decreasing size, or the diameter, they are very small. Because of that, they take it at a low rate. This is the reason why there is a delay of the transmission at the AV node, and this delay play very important role in the heart. In what way? One, this delay permit that the atria contract before the ventricle, and also permit the ventricle to fill itself with high amount of blood, so before it can contract. So this is the actual importance of the delay of the transmission of the electrical impulse at the AV node. Now, after the AV node, we have our AV bundle over here. This is our AV bundle. So this is our AV bundle. or bundle of His. So this bundle of His is also divided into two, the left and then the right. The right bundle of His covers the left, the left bundle of it covers the left atrium, the right bundle of it covers the right atrium, and then it will give branches to this important Purkinje fibers. These Purkinje fibers, they are being like made in such a way that their fibers are very large, and because of that they have numerous number of gap junctions, and because of that they transmit it like the transmission at a very high rate. Why? To permit the synchronous contraction of the heart. One thing, the heart, the left and the right, the two must contract at the same time. One do not contract before another, or some part do not contract before another part, and this is what we call the synchronous contraction of the heart. This is because the Purkinje fiber transmits at a very high rate. So look at, if this is coming fast, all the cells in there can get excited at the same time and then contract. But if it delays, some will get excited, some will not, and some part will contract, some won't contract at all. Now, this is the SA node, basically the pathway through which the generation of action potential from the natural pacemaker, or this the SA node, to the Purkinje fibers are made. Now, we see something over here. This is what we call the fibrous tissue. This, the green marker. This is what we call the fibrous tissue. The fibrous tissue actually divides the heart into two in such a way that this is like insulating component. So it doesn't permit the entering of electrical impulse from one part to another. So the atrial electrical impulse cannot transmit into the ventricle, so that the ventricle and the atrial contract at the same time. Do you understand? This is because of the presence of the fibrous fibers that covers the atrioventricular valves. We cover the atrioventricular valves and the whole of the atria and then the ventricle, divide it into two and permit only one passage, a way in which a place where you cannot find this fibrous tissue is the bundle of His, or the AV bundle. At that place we cannot find that. That's the reason why all the potential reaction, all the electrical impulse generated, they all move to the AV node, so that they will permit one-way transmission into the ventricles. Now, when you take the SA node is our natural pacemaker, because that is the one that generates high number of beats, that's 60 to 80, followed by the SA node, AV node, which is 40 to 60. Now, any part of the heart that generates, or any cell in here apart from the SA node that generates electrical impulse more than that of the SA node becomes the pacemaker. And at this condition, we say that pacemaker is called the ectopic. So we call it ectopic. We call it ectopic pacemaker. Ectopic pacemaker. And this ectopic pacemaker happens in certain conditions. In conditions like when there's a blockage of the transmission of the electrical impulse into the AV bundle. Now, into the AV bundle and then the AV node to be sent into the Purkinje fibers. What will happen is the AV node on its own can undergo auto excitation. That is, it can auto excite itself and generate 40 to 60 times heartbeat for the ventricles to get like continue its work. And because of that one becomes our pacemaker, and this is what we call the ectopic pacemaker that I was talking about. Now, in another condition too, where the AV node cannot transmit. There's a blockage in here, and the action potential cannot reach the Purkinje fibers. The Purkinje fibers also have the same ability of generating electrical impulse on their own. That is 15 to 40 electrical impulse on their own, and because of that, when there's a blockage, this one becomes our pacemaker. That is generating the electrical impulse for the ventricle to send what the blood to all parts of the body, for the ventricle to continue working. But its generation doesn't start like at the same time when there's a blockage. It delays about 5 to 20 seconds, and this delay of 5 to 20 seconds does not permit the ventricle to pump blood in this short time, and this can cause low level of blood at the brain side, and this can lead to like a short-term stroke, that is a ischemic stroke. And because of that, we say the cause is called the stroke Adams syndrome. Stroke Adams syndrome, a condition in which the work of the ventricles ceases within a short period of time, that is the 5 to 30 minutes, and does not pump the blood into the brain, and then the brain gets itself or does not function. That's what we call the stroke Adams syndrome. And basically, this is the nodal cells and what we need to know. Please, it's very, very important. Let's take note of this one, because these are the things that we are going to make emphasis on when you are talking about the intrinsic and then the extrinsic conduction system. Now, for the intrinsic and extrinsic conduction system, I'll be making detailed explanation of how the nodal cell undergo its generation of the action potential or generation of the electrical impulse, and how each cell generates and then transmits, and then the extrinsic, the intervention of the autonomic nervous system in this process. And then also, when you're talking about the EKG, we also make emphasis of this. So please take note of this process. Please, if you find this video useful, please kindly subscribe to the channel, like and share, and if you have any doubt, you can put it at the comment section. Please, thank you for staying with us to this time. See you in our next video.